So why do your knees hurt after a long day at work, like a long shift? Many people notice that the shift in itself is fine, you keep moving all day, but afterwards, when you stop, the knees start to ache. We've all been there. Some of the common symptoms include aching, stiffness, soreness, and this is actually very common even without an injury. So long shifts simply place sustained demand on the knees, and long shifts often involved prolonged standing, repeated walking, consistent movement with very little rest in between. Unlike short activity, this creates continuous load. There's very little recovery during the day as well, and some people in certain jobs don't even take a break when they're at work. They just want to get the job finished, get paid and go, and completely acceptable. Over time, this continuous load can lead to irritation, stiffness, and aching by the end of the shift. And that's not very nice, is it? So let's look at the role of fatigue. So we've got the muscles that support the knee, and they are the quadriceps, the glutes, the hamstrings, and the calves. Effectively, these muscles absorb the load during the movement. So as a shift goes on, your muscles begin to tire and the support around the knee reduces. This then places more stress through the joint, leading to soreness or irritation in the knee. Many jobs involve repeating the same position as before, such as standing in one place, walking the same routes, or even kneeling down for long periods if you're trades or something, and repeating tasks. Limited movement can reduce circulation and increase the stiffness. This is why knees often feel tight or heavy afterwards, not before, or even during. So pain often shows up after the shift, but people ask the question, why? So during work, you keep moving. Attention elsewhere, you're likely busy, but once you stop, the stiffness becomes noticeable and the soreness feels clearer. This doesn't mean damage, it's normally a response to load and fatigue of what you've done throughout the day. It's important to try and manage the load during the day. So let's talk about some small adjustments which can help. Take short seated breaks, shift weight between legs, and maybe briefly bend and straighten the knee, just up and down, okay? Even small changes reduce pressure on the joints, so it's worth giving them a try. So supportive footwear is also important as well. Shoes with good cushioning can reduce force through the knees. Obviously, if your workplace allows it, so make sure you check with them before. Some people also use a knee support during the day on particularly demanding days. This can provide gentle compression, a feeling of stability, and reassurance when your muscles are tired and stuff like that. Support works as a tool, not a long-term solution, remember, okay? Recovery is important, so make sure you allow time for rest, you prioritize sleep if you can, and space out your demanding days. Cold therapy, such as using ice wraps after your shift, may help reduce inflammation as well. Light movement after work can also reduce the stiffness, so slow knee bends, sit to stand movements, or if you go into the gym, or even light cycling if you're into that type of exercise, and the weather's nice, although it is the UK. The goal is restoring circulation, not intense exercise. So to summarize this video, knee pain after long shifts is very common. It often relates to sustained load, fatigue, and limited movement variety. With small adjustments, supportive footwear, recovery, and gentle movement, comfort after long days on your feet can improve.